I want to talk about mechanism of proteinuria in nephrotic syndrome. As a patient is having nephrotic syndrome, so there's like damage to the glomerulus. So I want to also give reasons why they might be losing so much protein as a result of the damage, right? It's something that I can literally say, yes, they lose protein, but it's always good to give a very good medical reason for that. So, nephrotic syndrome, they are losing proteins, losing proteins. Okay. So what we have is proteinuria in nephrotic syndrome. It occurs because the glomerular filtration barrier is the one that is being damaged. So as it is being damaged, things that were not supposed to pass through can now be able to pass through because there's no integrity again. So normal mechanism. This we're looking at the normal. The glomerular filtration barrier has three layers: fenestrated endothelium, glomerular basement membrane, podocyte. So together they prevent that what only things they permit to go through the glomerulus goes through. Do you understand? They prevent proteins because protein needs to be in the body to keep controlling the oncotic pressure. But now there's now structural damage to the glomerular basement membrane. So there's loss of negative charge, there's thickening or disruption of the basement membrane, there's podocyte injury, there's effacement of the food processes, there's loss of slit diaphragm proteins. Okay, and now things that were not supposed to go through the glomerulus membrane are able to go through, you know, because there's damage. So increased permeability, so albumin and other plasma proteins can now be able to cross. Tubules cannot reabsorb this. So there's hypoalbuminemia, do you understand? Low albumin levels leading to edema. There's hyperlipidemia. So the liver is trying to compensate and produce more lipids, which are mostly bad lipids, cholesterol. Okay, there's loss of immunoglobulins and also clotting factors. So there's risks of infection, and the person can be having some abnormal blood clottings anyhow. Okay.